Just realized I was on mute. We'll go ahead and get started, everybody. Thank you so much for joining us today for this session. I'll be asking the presenters the questions that you submitted in the platform. My name is Anna from AMCHP, and I'll say if you didn't get a chance to submit your question in the platform, you can go ahead and submit them in the chat box now here in Zoom. Otherwise, you can also unmute yourself to ask a question. Before we get started, I'd like to give my colleague Kat a chance to introduce herself, and then we'll turn it over to our speakers to introduce themselves, and we will get started with the Q&A.
Hello, everyone. My name is Kat. I am an intern at AMCHP on the Evidence and Implementation team. And with that, I'm very excited to be here and hear our presenters.
Hi, everyone. My name is Geeta Wadhwani. I serve as a program leader with Children's Health Alliance of Wisconsin. And I will turn it over to Sophia.
Hey everyone, this is Sophia. I'm the executive director at Freedom's Food Pantries in Milwaukee. We have 4 community food centers across the city.
Hi there, I'm Jacqueline Whalen with Children's Wisconsin. I'm the director of care integration here, focusing on some of our health equity efforts and better integration into the community. And I'll turn it over to Martha.
Hi everyone, I'm Martha Collins, former Director of Advocacy and Outreach for Feeding America Eastern Wisconsin. And we are a food bank here in the state of Wisconsin that serves over 35 counties here in our great state.
Thank you all so much. So I see we have a lot of questions to get through, so hopefully we can get through them all in our time together. The first one I have here is, can you share the partner tool that was for how each partner expertise and contribution was gathered?
Hi, sure, I can share. So there are several handouts in the PDF. There were a number of documents that were shared to sort of get some buy-in with the partners. So there is a framework that described what we hope to accomplish. That's in the handouts. There is a charter and a timeline which offered each of the partners more specific details about what we were asking for in terms of your time and some of the more concrete action steps we were asking you to take. And then what else is in the handouts is kind of the kickoff meeting. Again, a way to ask each of the partners the same set of questions to gather different perceptions. And then the last piece that I'll offer is one of our other partners who isn't joining us is Data You Can Use, and they are our evaluation experts. And so they had both a qualitative and a quantitative tool. So we co-created, myself and our evaluator co-created some evaluation questions really centered around collaboration. And then we had a collaborative survey question tool.
Okay, so our next question, I'm just going in the order that they came in here. I know you answered this in the chat, Geeta, but if you could reiterate in case folks missed that. What, if any, roles did the State Title V MCH Block Grant and the State Department of Health play in this initiative?
Yes, for sure. So we are one of 6 initiatives at Children's Health Alliance of Wisconsin, and we are a partner to Wisconsin DHS. Our particular team is funded through maternal child health dollars as well as children and youth with special health care needs. So we're working on several national performance measures. For the purpose of this pilot, we did start under our children and youth with special health care needs, really with a focus of coordinating care services and supports as a way to move the needle on care coordination, particularly for children and youth with special health care needs. But in addition to sort of the contractual piece with our MCH and children and youth with special health care needs partners, they were partners in both building buy-in to test this work, as well as partners in the learning and the sharing.
Thank you for that. And I believe this next question might be for Martha and Sophia, but if anybody wants to answer, please do. Are SNAP or TANF enrollment requirements for participating in your food programs?
I can take that one. And sorry if my internet connection is a little unstable today, but no, absolutely not. So anyone can use our food pantries, and it's a little confusing because sometimes it does depend on what inventory we're getting, like if it's federal commodities or not. If it's a purchased product, then we can give it away to anybody we want. So I won't bore you guys with all the kind of different qualifications, but absolutely SNAP is not a qualification for the food pantry. We even serve a significant number of folks who are undocumented and therefore not eligible for all their benefits. So we definitely wouldn't want to create additional barriers for people accessing food. That said, we do a lot of partnerships with Feeding America and other entities to help connect people to SNAP benefits if they are not, if they're eligible and they are not enrolled. We want to help them get as many benefits as possible to get the food that they need.
Absolutely. So that was a key part of my role when I was at Feeding America Eastern Wisconsin, was to manage the SNAP outreach team. And they were, a group of individuals that, as Sophia mentioned, would go to local emergency feeding places and just kind of meet people where they're at. SNAP, supplemental is the first word in SNAP. So we do understand and know that food shares, what we call it here in the state of Wisconsin, or food stamps, formerly known as food stamp benefits, does not last the entire month. And many of the families, individuals, households receive benefits as well as visit the pantry. So we want to make sure that they're receiving the maximum benefit that they're eligible for, and that we help them navigate through renewals and submitting of verification documents and things like that. So it's not a requirement in order to receive food, as Sophia mentioned, but it does help not only themselves, but as well as the frequency someone may utilize a pantry or meal site.
Thank you both. And in reflecting on the part of your presentation where you were talking about the alphabet soup, would either of you mind popping in the chat what SNAP and TANF stand for? Thank you both. All right, so for our next question, what lessons learned from the pilot do you feel would be most informative to organizations outside of Milwaukee? And are there plans to disseminate what has been learned with similar groups in the state and across the country?
So I'm actually going to lean on each of my partners to share their lessons learned. We as Children's Health Alliance were the convener. I'll share one maybe from my perspective. For each of these partners, I would say it was varying degrees of sort of buy-in, because it wasn't about Jacqueline, Martha, or Sophia necessarily saying yes, but it was about their time and their institutions wanting to buy in and thinking about this work in a different way, thinking about how you come together and convene. And early on, some of the feedback we got was, why is this taking so long? Why can't we just do? And we really set out to say we can't do together until we know one another. So we need to be with one another, have some trust, and then figure out how to build those connections. But I think Jacqueline alluded to this, but I would say early on too, there was a lot of bridge building. So me saying to Jacqueline, did you hear what Martha said? And helping Jacqueline to link it within the context of healthcare, and vice versa for Martha, and for me to say to Martha or Sophia, did you hear what Jacqueline said? And this is how you might think about how it fits. So I think the convening piece for anyone who's trying to bring sectors together really does help when you have that sort of neutral voice building those connections.
Yeah, I think from a healthcare perspective, the bigger picture lessons learned that would be applicable kind of outside our market are really, as Gita mentioned, kind of having that convener and building those cross-sector relationships. And I think just understanding kind of the complexity of both systems, right? So I certainly did not, as you heard me mention, recognize the complexity of food systems, of emergency food provisioning, of really the vision that both Martha and Sophia shared of it's food and, right, that's a doorway where you can kind of embrace, whole health, which I think is a parallel pathway we're on at Children's, where maybe healthcare is what's being accessed, but we're really trying to think about the whole child and the whole family. And so I think those learnings are just really critical to establish the relationships and to get to the next phase of where we are now, which is what does it tactically look like to elevate the voice of the family and the community to tell us how to better connect them to what they need. And so that's where we're starting to think about, how do we get that feedback? What does that look like? Which I think would be a natural evolution. But if we had jumped to that step, I would encourage everyone to take the time for the relationship building and the learning, because as Sophia mentioned in the presentation too, there's lots of natural traction that starts happening just through the relationship building.
And
Yeah, I almost don't even have a lot to add to that, because I think my biggest takeaway is the same thing that Gita and Jacqueline have been saying, but just that early on, I think I came into it thinking, yeah, I understand, like I'm ready to get, roll up my sleeves and get some stuff done, because that's kind of how I'm wired. I'm a doer. And then over time, I realized, oh wait, this is way more complicated than I realized. I didn't quite know what I was walking into when I said I was going to partner closely with a large healthcare system. So I think just making sure you do take the time to really make sure that everybody around the table understands, because in the community work that I've done, you can't invite people into spaces and not provide them enough background so that they are able to participate fully. And if you skip that step, you're going to leave people behind. So yeah.
Ditto to everything that's been said. But I think one thing I do want to add, that it was a takeaway of something that I learned from this a lot already, was mentioned in this time together and in the video. We know the importance of food equity and health equity and, some of the things that was just mentioned, but what just popped in my head was kind of the African proverb of, if you want to go fast, go alone. If you want to go far, go together. And this was definitely in action and continues to be in action, that proverb, right? And so, I'm just very thankful for the relationship building part of this, because now I feel like I have a community and a network, and I'm not going alone at this. And if you've done any type of work for any period of time in this realm of food equity and hunger and food insecurity, as well as health disparities and things like that, you can get burnt out really quickly and you feel like you're running up against a brick wall. And so I'm just really thankful for the relationship portion of this, because I know it's long lasting, it's not transactional, it's transformational. And, again, ditto to what's already kind of been shared.
I love that, Martha. You described it as not transactional, but transformational. I have to keep that with me. I appreciate the way you phrased that. Okay, thank you all. The next question is, what are the plans to make this partnership and work sustainable?
I think one thing I'll jump in and say, because we've, in full transparency, that's a question we've been really asking ourselves a lot right now. So I don't know that we have like all of the answers, but we've realized that it's going to be really important, number one, to have more than one individual and, from each entity represented at the table, right? Like if only one person is involved in the project from beginning to end, when that person leaves, then you lose kind of all of that knowledge within the organization. So I think it's been important for us to kind of just, now that we have kind of individual relationships, right? Like I know Jacqueline really well, I know Martha and Gita really well, but getting to know some of Jacqueline's colleagues, getting to know, other people like in Gita's department, just so that there's some duplication. But I think in addition to making sure that we have people kind of in the decision-making roles and some of the people in the kind of direct service roles involved going forward, so that we get buy-in from every level. And especially as we start this kind of new phase of seeking participant, more intentional focus groups, I think that's a natural step for us to start including more people. But yeah, that's definitely something that we are actively kind of working through right now. And I'll say those are the two things that I feel like stood out to me.
I'll let Gita provide feedback on the big picture too, but from a health system perspective, I wanted to offer that, the more of these community relationships we're building, the more we're able to advocate with the senior leadership teams within our health system about the importance of capacity building in the community, and kind of directing, we are resource rich compared to many of our community-based organization partners. So directing, the right capacity building, whether that's, staffing we can offer, nutritionists that we might be able to get on site at a pantry, whether that's actual kind of community-based investment to allow CBOs to build capacity. I think that by the relationship building, Sophia and Martha have helped create some internal advocates at Children's to kind of reframe thinking about health system investments in this space, ultimately, which would get at that kind of sustainable partnership model, even, thoughts about shared resourcing and better connectivity between health systems and community-based organizations. So I just wanted to give a nod to the health systems role and kind of, catching up with building capacity in the community.
So, and just in terms of, I'll try and jump in on the sustainability piece. I think that's something that we've thought about from the get-go. So for those of you who are with maternal child health, so we've been really fortunate to have our MCH state partners who have been able to fund our work, not only my time, but each of the partners for their time and expertise. And we know, grant funding, it always has a limited duration. So I think there's a few areas, like in the short term, we're looking at grants and looking to how can we leverage some of the resources that are of a health system. They aren't always financial, right? There's a lot of resource and expertise there to help build capacity. The other piece that is more of a long-term piece is around some of the work that at the national level, CMS and then Medicaid are thinking about new ways of funding and financing sort of the whole health, both bringing in health plans, health systems, and community-based organizations, because no one institution, no health plan can address housing and food and employment. But folks like Sophia and Martha who work on the ground are really the experts. And so that is another lever that we're trying to explore for how we can continue to financially support our community-based partners to truly be, to have the capacity, right, to be those people on the front lines, to work collaboratively across sectors. So I think we know that's sort of the long-term piece that we're working towards, and in the short term, we're looking at other sources of funding, whether it's local, state, or national.
Thank you all for that. And I do want to acknowledge that we're at time for this session. So if folks need to roll off, I understand and feel free to do so. But I do want to ask our presenters the two remaining questions that we have. And just as a reminder, this is being recorded. So if you need to roll off and you want to catch these answers later, you can watch the recording. So the first of two is, as the pilot evolves, is there data sharing among partners around referrals and services provided for the family?
A really good question. I'll start. Sophia and I have had conversations in this space. We did actually do just some kind of global, very aggregated, non-identifying kind of data comparison initially, which on the health system side, we were able to, in some ways, just kind of get a heat map of location of the patients and families we were serving for the two primary care locations where we were focusing this pilot, and kind of understand proximity to some of the pantries within Sophia's network. And I think that was really insightful in terms of understanding the geographies from where our kids and families were coming to the bricks and mortar clinic, but being able to identify that really, Sophia's network of pantries could serve the majority of the populations within those two clinics. Additionally, at Children's, we are doing more intentional screening and documentation of social needs. So we were able to surface some data. We actually screened the most families in our emergency department, surprisingly, but we were able to surface some data about where we see prevalence of food insecurity based on families we're screening. And then also we're able to offer more intentional referrals to Sophia's network of pantries and food partners. We have been in conversations about what would it look like to have more intentional kind of data sharing to understand, are there kids and families being served by Sophia's teams where we may not know that food insecurity exists? We haven't acknowledged that as part of, you know, the family's journey in health. But I think to date, we've been focused more on the aggregate, and now are kind of, you know, in discussions about what would it look like to be kind of data sharing more intentionally. But a big part of that, I think, is just the role we have in kind of empowering and ensuring community-based organizations have the needed data literacy. In healthcare, you know, we talk about PHI and HIPAA and all kind of the aspects of data sharing. That looks really different when you get into cross-sector data sharing and making sure that community partners feel like there's kind of a systematic approach to that. So I'll let Sophia weigh in a little more in that space.
Yeah, well put, Jacqueline. We spent a lot of time talking about this, and this was an area of significant learning for me. And I think this is probably the part where trust came in the most, right? Like, we have data on, I mean, probably almost every single person who has, you know, in Milwaukee who's used a food pantry. So that's thousands of people's data that we have, that we, you know, it's very confidential to us. And so that trust piece was really, really important, where I could come back and I could push back on, right? We floated kind of an MOU back and forth, and I was able to say, like, look, I'm just not comfortable with this yet. We need to put more parameters in here about like what this data is going to be used for, or how it's going to be destroyed at the end, where it's going to be saved. Because you know, I think, especially from a smaller CBO perspective, working with like a really large organization like Children's, I think some of those kind of preconceived notions or like just fears of what's this data going to be used for definitely came into play. But working really closely with Jacqueline and other folks on her team that I got to know well, like the trust really helped feel like we were kind of equal partners in creating that MOU. I think the other thing that, you know, Gita mentioned capacity earlier, and capacity has definitely kind of come into play a lot when it comes to data collection. Like, there's a lot of stuff that from our perspective, you know, we have a pretty thorough screening when folks come to the pantry, but beyond that, it's really hard for us to, I mean, we have a small staff. Like, if we were to pull someone to the side and have a whole 45-minute conversation with them, we just don't have the resources, the staff resources to do that. And so it's been kind of cool to you know, talk with Jacqueline and say, like, hey, your team might have more capacity. Here are some questions that we are both interested in getting data on. Are your social workers able to kind of do screenings for this data and share it with us? And so it's been, I think that's just scratching the surface, right, of how we can use their additional capacity and or start building up our food pantry's capacity to collect more data. Yeah.
Thank you both for speaking to that question. And then the final question that came in through the Zoom chat here from Victoria: are you collecting any qualitative or quantitative data throughout the food pantry system? And I think you touched on this a little bit, Sophia, but I leave that to you all.
Yeah, for sure. So when folks are coming to the pantry, I mean, number one, we make it really clear that if there's anything that they don't want to answer, this is all confidential information. It's not shared with anybody. And if they don't want to answer something, they don't have to answer it. But we do ask quite a bit of questions, right? Like basic stuff about race, ethnicity, gender, where do they live? But we're also incorporating some questions about dietary needs. So we're screening people for, you know, diabetes, allergies, no pork, right? Celiac, anything that would, they do choose their own groceries. So it's not, they're offered a variety of things that they can choose based on their dietary needs. But at the same time, it's able to paint a picture of what are the dietary needs in our community, what are transportation needs in our community, are they renting, are they owning their home, right? This is kind of helping us paint a picture of the neighborhoods that we're serving that have allowed us to kind of identify other social determinants of health that may be preventing people from getting the resources that they need, or even, for example, like if they want to change the bus routes, like we have very strong data to support, like, hey, no, our pantries are on bus routes, like you can't change the bus routes. So stuff like that. In terms of qualitative data, that's, I think the next phase, like I'm really interested to kind of sit down with folks and get more of that, their stories, right? Because to me, data without stories is kind of empty data, and stories without data is also kind of hard too. So I'm excited to get that full picture down the road.
Well, thank you so much to our presenters for sharing your work with us. I know I I find it to be very inspirational and really appreciated the discussion on the time that you need to invest in building trust and relationships before immediately jumping into the work. And even when you're in the work, still to work on that trust and relationship building. So I very much appreciate you all sharing your work with us today. And yeah, thank you. I hope everyone has a great rest of the session. We have some networking opportunities kicking off at 1:30, and then our next round of workshops, I believe, start at 2:30 p.m. And this is all Eastern, of course. So hope to see you in the platform again. Thank you, everybody.
Thank you.